Immunology review for the NPLEX board exam. Interleukin 1, alpha and beta, comes from macrophages and other antigen-presenting cells. It stimulates other antigen-presenting cells, T cells, inflammation, and fever. Interleukin 2 is a Th1 marker, which comes from Th1 cells and natural killer cells, and activity causes the proliferation of B cells and activated T cells as well as antibody production. Interleukin 3 comes from activated T cells and causes histamine release by mast cells. Interleukin 4 comes from Th2 and mast cells and causes B cell proliferation, eosinophil and mast cell growth, IgG, IgE, and class II MHC expression on B cells. Interleukin 5 comes from Th2 and mast cells. It causes eosinophil growth and function, as well as IgA synthesis. Interleukin 6 comes from Th2 cells, as well as antigen-presenting cells, and causes B cell proliferation into plasma cells. Interleukin 7 comes from thymic and marrow cells, and causes differentiation into progenitor T and B cells. Interleukin 8 comes from macrophages and causes a chemoattractant activity for neutrophils and T cells. Interleukin 9 comes from T cells and causes hematopoietic and thymopoietic effects. Interleukin 10 comes from Th2 cells, CD8 T and B cells, as well as macrophages, and causes inhibition of cytokine production, promotion of B cell proliferation and antibody production, as well as suppression of cellular immunity and mast cell growth. Interleukin 11 comes from bone marrow and stromal cells and causes hematopoietic and thrombopoietic effects. Interleukin 12 comes from B cells, T cells, macrophages, and dendritic cells, and causes proliferation of natural killer cells, interferon gamma production, promotes cell-mediated immune functions, and stimulates Th cells from Th naught cells. Interleukin 13 comes from Th2 cells, B cells, and macrophages, and causes the proliferation of B cells, as well as inhibition of macrophage inflammatory cytokines. Interleukin 14 comes from T cells and malignant B cells and causes proliferation of B cells as well as their growth. Interleukin 15 comes from virus-infected macrophages and causes production of natural killer cells. Interleukin 16 comes from eosinophils, CD8 T cells, lymphocytes, and epithelial cells, and is a chemoattractant for CD4 cells. Interleukin 17, 21, and 22 comes from Th17 cells, leukocytes, and peripheral tissues, and causes an increase in inflammatory cytokines, angiogenesis, tissue inflammation, autoimmunity, and clearance of extracellular pathogens. Interleukin 18 comes from macrophages and causes an increase in natural killer cell activity, as well as production of interferon gamma. Interleukin 23 comes from macrophages and causes an increase in Th17 response. Interferon alpha and interferon beta comes from macrophages, neutrophils, and some somatic cells, and causes antiviral effects such as class I MHC on all somatic cells, and activation of natural killer and macrophage cells. Interferon gamma comes from Th1 in natural killer cells and causes an induction of class I MHC on all somatic cells, activates macrophages, neutrophils, natural killer cells, promotes cell-mediated immunity, and has antiviral effects. Tumor necrosis factor alpha comes from macrophages, adipocytes, and Th1 cells, and causes an increase in cytokine expression by macrophages, increases fever, increases vascular permeability, and induces clotting to contain infection. Tumor necrosis factor beta comes from Th1 cells and Tc cells and causes phagocytosis and inhibition of angiogenesis. Granulite colony stimulating factor comes from macrophages and causes differentiation of neutrophils. Granulocyte monocyte colony stimulating factor comes from Th cells and causes differentiation of monocytes and dendritic cells. Monocyte colony stimulating factor comes from epithelial cells and causes differentiation of monocytes. Tumor growth factor beta comes from Treg cells and induces an immune suppression. Prostaglandin PGE2 comes from endothelial cells and is made by cyclooxygenase 2 and causes fever, vasodilation, sensitization to pain, and causes a cytokine production. Prostaglandin PGI2 comes from endothelial cells, is made by COX2, and leads to vasodilation and has an anticoagulant effect. Nitric oxide comes from macrophages and endothelial cells. It is made by nitrous oxide synthetase and causes anti-clotting, leukocyte recruitment, and has antimicrobial activity as well as vasodilatory effects. Leukotrienes comes from basophils and mast cells and increases vasopermeability as well as vasodilation. Histamine comes from basophils and mast cells and causes vasopermeability and vasodilation. Heparin comes from basophils and mast cells and has an anticoagulant effect. And thromboxane comes from most cells, is made by COX-1, and leads to clotting and vasoconstriction. Microbiology review of viruses. Poliovirus damages motor neurons, causes flaccid paralysis, leads to muscle atrophy, and causes pain. Post-poliomyelitis syndrome is permanent weakness. Coxsackie virus has a type B and type A. Type B, most common, leads to conjunctivitis and stomach flu. Type A, known as hand-foot-mouth disease, leads to fever, sore throat, decreased appetite, and a spotted rash on palms and base of feet that develop into blisters. Echovirus, most common non-bacterial central nervous system infection, can lead to meningitis, which has migratory pain, stiff neck, photophobia, and headache. The Rhinovirus, common viral infection, grows in the upper respiratory tract. Symptoms are sneezing, sore throat, runny nose, caused by histamine and bradykinin release. Hepatitis A, known as infectious hepatitis, viral hepatitis, very common in daycare setting, infects the liver cells, has an incubation of 30 days and a 2-week virus shedding prior to that. It comes as a sudden fever and manifests as jaundice, flank pain, and dark urine. Norovirus, Norwalk virus, found on cruise ships, nursing homes, and military, common amongst adults. You can get it by bad food ingestion or water, and it causes nausea, vomiting, and diarrhea. Hepatitis E, found in water contamination, third world countries mostly. Hepatitis E will not become chronic, but poses a risk to pregnant women. Rubella, known as German measles, spread via secretions, can manifest as a mild rash with flat red spots. Pregnant women can spread to their child, leading to cataracts, deafness, and heart abnormalities in the child. Yellow fever, dengue fever, West Nile, and hepatitis C. St. Louis encephalitis as well, which is rapidly fatal encephalitis. Yellow fever is endemic to Africa and South America and leads to encephalitis and can be identified with black vomit. Dengue virus causes encephalitis and easy bruising as well as bloody diarrhea, and is otherwise known as break bone fever due to bone pain. West Nile virus has a reservoir in birds and also affects horses. Hepatitis C is IV drug use, sexual intercourse, and is the chronic hepatitis. SARS, severe acute respiratory syndrome, upper and lower respiratory tract infection, spread via aerosol. Coronavirus, second most common cause of the common cold, but more powerful than the common cold, manifests as a persistent cough, happens in the winter, and is only an upper respiratory infection. Middle East respiratory syndrome. Reservoir is found in bats and camels, and is mostly in Saudi Arabia and the United Arab Emirates. HIV-1, spread via sex, secretions, transfusions, and IV drugs. The virus attaches itself to CD4 cells. The provirus integrates itself into the host genome. HIV-1 has 4 stages: primary, latent phase, which lasts 10 years, progression, and end stage. You know that AIDS has happened once the cells have reached less than 200 count for the CD4s, and HIV can be diagnosed with PCR, ELISA, and Western blot. HTLV-1, human T-cell leukemia virus, infects CD4 cells and is transmitted via blood, sex, and breast milk, and is endemic to only Japan, the Caribbean, and Africa. Rabies virus, bullet-shaped virus. It has an animal reservoir. Incubation period is 1 to 3 months. First signs of rabies is pain, gastrointestinal issues, anorexia, fatigue. Then leads to neural damage, hydrophobia, which causes foaming at the mouth, and death is a serious side effect. Identify rabies with Negri bodies in brain cells, as well as increased IgM levels. Parainfluenza affects young kids. 75% of croup is caused by parainfluenza, and this sounds like a seal bark. It's an upper respiratory infection, leads to hoarseness and a sore throat. Mumps is spread via saliva, swelling of the parotid glands, and can lead to sterility in the testes or ovaries, as well as encephalitis or deafness. Rubella, otherwise known as measles, is the most infectious agent known. You can find it with giant multinuclear cells and complex spots in the mouth, which are salt grains on red pimples, as well as a rash on the entire body. Rubella can also lead to encephalitis. Respiratory syncytial virus. Most common, childhood pneumonia and bronchiolitis. Every child will get this by 4 years old. It's mostly spread via the air in the winter, and elderly can get it as well. This predisposes the victim for asthma and allergen sensitivity. Influenza. Type A is pandemics and annual, whereas Type B influenza is just annual. Antigenic shifting is fast, antigenic drifting is slow. Ebola, found in Africa, causes a hemorrhagic fever, bleeding from the skin, gastrointestinal system, as well as mucous membranes, and is spread via contact. Marburg is seen from green monkeys and causes bleeding from the skin, gastrointestinal bleeds, and mucous membranes, as well as this is a less deadly form of Ebola. Norovirus is from mouse droppings, can be found in the Four Corners area of the United States, leads to hemorrhagic pulmonary dysfunction, and it is unable to be transmitted from human to human. Lassavirus is endemic to Africa, is transmitted via rat droppings, and very similar in symptoms to Ebola. It is the most common imported hemorrhagic fever, and there is no human-to-human spread. Rhinovirus causes severe diarrhea in kids under 2 years old. It is found in impure water and infects the jejunum epithelium. It destroys microvilli and is a non-bloody diarrhea, which causes dehydration. Hepatitis delta virus also requires a co-infection with hepatitis B. HBV must have HDV to be HDV. Papillomavirus is a double-stranded DNA virus. Most common STD for teenagers, most common sexually transmitted virus. Genital warts are HPV 6 and 11. Cervical warts are HPV 16 and 18 and may lead to squamous cell carcinoma. Polyoma is a double-stranded DNA virus found in most people inactively. Once a person contracts AIDS, it becomes active and may lead to bladder cancer, as well as destruction of brain tissue. Also, progressive multifocal leukoencephalopathy. Adenovirus is a double-stranded DNA virus, which causes respiratory diseases like febrile pharyngitis, as well as tonsillitis, ear infections, and croup. Adenovirus can also cause conjunctivitis and gastroenteritis. Parvovirus B19 is a single-stranded DNA, otherwise known as fifth disease or slapped cheek syndrome. A slapped cheek rash and body rash manifest. 6 to 10 years old is the normal range, and this can cause aplastic anemia, polyarthritis as well. Herpes Simplex 1 and 2, and Varicella Zoster virus. HSV1 is above the waist and can affect the mouth and lead to myalgia and fever and even corneal blindness. HSV2 is below the waist on the genitals and can affect the cervix and result in pain, fever. Varicella Zoster virus. Varicella is chickenpox, whereas Zoster is shingles. Varicella, chickenpox, binds to the respiratory tract, and the rash looks like dewdrops on a rose. This is a lifelong infection. Shingles is caused by reactivation of latent virus chickenpox, and never give aspirin with chickenpox because it leads to Ray's syndrome. Cytomegalovirus is a common STD in teenagers, may lead to mononucleosis, can lead to congenital defects and rash, as well as a swollen spleen. Roseola cytomegalovirus can lead to pink baby, otherwise known as sixth disease, and can lead to seizures. And herpes virus 7 from monkey bites leads to immune hypersensitivity, as well as seizures. Epstein-Barr virus, otherwise known or passed through kissing, can lead to mononucleosis, as well as Burkitt's lymphoma. Mononucleosis spreads to B cells in the spleen and blood and may cause Hodgkin's disease. Burkitt's lymphoma is an African form, leads to jaw tumors. And herpes 8 is otherwise known as Kaposi sarcoma, which affects AIDS patients and manifests as purple lesions on skin and mucous membranes. Hepatitis B virus, partially ssDNA and dsDNA, otherwise known as serum hepatitis, can be transmitted via IV needles and blood. Causes icteric symptoms, jaundice, dark urine, and light stools. Diagnosis can be done through liver enzymes, ELISA, HBV, antigens, and PCR. And the symptoms of hepatitis B are increased with hepatitis D infection. Variola virus, cowpox virus, molluscum contagiosum. These viruses are brick-shaped and otherwise very large. The smallpox virus, otherwise known as variola, is replicated in the lungs and manifests as skin pox in a cytokine storm and may lead to hemorrhaging and encephalitis. Molluscum contagiosum causes wart-like eruptions on skin around the genitals and tropical areas, spread via direct contact. Prions, known as transmissible spongiform encephalopathies, are misfolded proteins caused by ingested brain tissue. Kuru is the New Guinea version of prions, which causes shivering, trembling, and laughing outbursts, also from eating brain tissue. Creutzfeldt-Jakob disease is the most common form of the spongiform encephalopathies. Occurs in 50 to 60-year-olds. About 1 in 1 million people have it, and it leads to rapidly progressing dementia, memory loss, personality changes, hallucinations, jerky movements, changes in gaits. There's a version called variant Creutzfeldt-Jakob disease that happens in the youth. Scrapie is a sheep-derived virus which affects the nervous system and is degenerative, which leads to lip smacking, strange gaits, and convulsions. And bovine spongiform encephalopathy is also a fatal neurodegenerative disease that infects cattle due to spinal cord mixed into their food.